Good morning, all. Welcome back to my YouTube channel. Don't forget to subscribe my channel and also please give your valuable comments. So today we will discuss one of the very important topic in Kaumarbhritya. So that is Graha Rogas. And when we talk about Graha Rogas, it's very clearly told that Graha Roga is one of the main subject matter of Kaumarbhritya. In the definition itself by Sushruta, it is told that तत्र कौमारभृत्यं नाम कुमारवर्णं दातृक् क्षीरदोषतं शोधनार्थं दुष्टस्तन्यग्रहसमुत्थानाञ्च व्याधिनां दुष्टस्तन्य and दुष्टग्रहसमुत्थानाञ्च व्याधिनां. So Graha Rogas has been given importance right from the beginning itself in the definition itself. Further, if we go for another important definition of Kaumarbhritya given by Sushruta, that is Navagraha Akriti Vijnanam Skandasya cha Nishedanam Apasmara Shakunyasya Revatyascha Punapratak. So like this, where Sushruta explains 9 grahas. So Sushruta basically explains 9 grahas, and that has been explained very well in the definition itself. Of course, Sushruta at the end says Sharireshu Chikitsa Kaumardantram Sharireshu Chikitsa. Not only these Graha Rogas, not only these Graha Yoni Rogas, not only this some of the disorders of the mother, but also the subject matter which is mentioned in the Sharirasthana of Sushruta Samhita is also comes under the purview of Kaumarbhritya. So that has been explained by Sushruta. So now these two definitions itself mentions the grahas with great extent. So therefore, Graha Roga is definitely one of the important subject matter of Kaumarbhritya. But unfortunately, most of the time these Graha Rogas are not taught well. Most of the time it is untouched topics. Okay, so the reasons are many why students consider this as a outdated topic sometime or untouched topic. Because there is more and more mythological explanation is given with respect to the Graha Rogas. The mythological explanation is too much. So many times we fail to explore or decode the mythological explanation, and we fail in understanding them in scientific manner. And that may be one of the reasons why we are neglecting the Graha Rogas. Again, one more important thing is it's very difficult to understand the concepts. If you routinely reading these Graha Rogas, it is quite difficult to understand the concepts of the Graha Rogas. But if you analyze them under the scientific background, then we may able to understand the hidden concepts of Graha Rogas. Third important thing why these Graha Rogas are not considered seriously, because as far as examination is concerned or practice is concerned, we don't know the clinical utility of the subject. Of course, we can study so many grahas, and so we can study so much of shlokas and all those things, but how to apply these concepts clinically, again we are not clear. That is one more reason why this topic is not gaining much importance. In other words to say, the scientific truth which has been explained in the religious bottle is not able to explore. We are failing to explore the scientific truth which is explained under the religious bottle. What I mean to say is, many of the facts which are mentioned in Graha Rogas are based on the religious facts. There is explanation of Shiva, there is explanation of Parvati, Kartikeya, okay, and there is so many stories, so many Rakshasas coming, Revati, etc. is coming. So many religious aspects are mentioned along with this Graha Roga. So we are actually not able to understand, and that is the main factor why, although this is one of the main subject matter of Kaumarbhritya, it is not dealt in detail. Most of the time, students also not feel interesting when you are teaching these Graha Rogas. Now, this is our responsibility to make this topic interesting by exploring the scientific understanding of this Graha Rogas. Now, come to the first part, and we'll go by one in a detailed manner, so that there should not be any confusion in future. Now, if you see, there are two important things are there. One is Graha Roga and another one is Graha Chikitsa. Now, if you look into the Vagbhata's explanation of 8 branches of Ayurveda, Kaya, Bala, Grahodvanga, Shalya, Damshtra, Jara, Vrusha, and Ashtavangani. So, Kaya and Bala, and then Graha. So, among the 8 branches of Ayurveda, also there is mentioning of Graha chikitsa. Just like Kaya chikitsa, Bala chikitsa, and there is also Graha chikitsa. Now, if you look into the definition of Kaumarbhritya, Tatra Kaumarbhrityam Nama Kumaravarnam Dhatri Kshira Doshatamurtanam Dushta Stanya Grahas Samuttanam Cha Vyadinam. Again, the word Grahas comes in Kaumarbhritya definition also. Now, the basic question is the Grahas which are mentioned in the Graha Chikitsa as 8 branches of Ayurveda, and Grahas which are mentioned especially for the Kaumarbhritya, whether they are one and same or whether they are different. Because word given is only Graha. One is Graha Chikitsa and another one is Graha Dushti or Graha Bada or Graha Roga, etc. Okay. But if you look into Charaka, Charaka never talks about these Graha Rogas. That means especially Bala Grahas, he is not talking much. Of course, in Chakrapani there is one word Skanda Ityadi like that. Except that in the original Samhita book, there is no mentioning of the Bala Grahas or Grahas pertain to the children. Whereas Sushruta mentioned Grahas pertaining to the children. He mentioned Graha Chikitsa also, but he also mentioned the Grahas pertaining to the children. Vagbhata mentioned Graha Chikitsa also, but he also mentioned the Grahas pertaining to the children as a separate entity. Whereas Charaka is not mentioned the Grahas for, especially for the Balas. Bala Grahas are not explained by Charaka. Of course, Charaka mentioned the word Graha. If you study the Unmada and Apasmara, etc., we find different types of the Grahas like Deva Graha, Gandharva Graha, Rakshasa Graha, etc. But pertaining to the Bala or children, it is not mentioned by Charaka. And Charaka also says Grahas to Aparisankheya. Charaka says that Grahas to Aparisankheya, they are innumerous number, infinite number. Anyway. And if you look into Ashtanga Sangraha, he dedicated so many chapters in Uttar Tantra for the Grahas, okay? Graha Pratisheda, Bhuta Pratisheda, Pishacha Pratisheda, then Skanda Pratisheda. So like that for the different Grahas also he mentioned different chapters. So this type of attribution is absent in some of the other Samhitas except Ashtanga Sangraha. So now later books like Ramanakrita Kumar Tantra, then Chakratatta, then Gadanigraha, Vaishajaratnavali also mentioned about Graha Rogas. And one of the books that is Agni Purana also mentioned so many Graha Rogas. And another book written by Kalyana Vaidya that is also mentioning some of the Graha Rogas. Of course, there looks like a repetition as what is mentioned in Samhitas except some differences, minute differences. Now the big question remains same, whether the Graha Rogas which are explained particularly to the Kaumarbhritya by different authors and Graha Chikitsa which is mentioned as one among the 8 branch of Ayurveda, whether they are one and same or whether they are different. If they are one and same, how? If they are different, how? This is a basic question that we need to answer. Then only we can carry on. Does Graha Roga and does Graha Bada are one and same? This is a big question now. See, the Grahas which are mentioned in the concept of Graha Chikitsa as one of the branch among the 8 branches of Ayurveda looks different from the Grahas which are mentioned pertaining to the Bala Graha or in the Kaumarbhritya. Okay. If you look into the Chikitsa of the Graha Chikitsa, Apyayana, Prasadana, etc., so it definitely looks like more towards some psychological involvement. Okay, there is some neurological and more psychological involvement, and it looks like a change in the mood, change in the temperament, change in the thinking capacity, change in the intellectual levels, okay, change in the personality, change in the behavior. So such factors are more highlighted as far as Graha Chikitsa is concerned. And Graha Chikitsa is not only for the children, Graha Chikitsa is for the adults also. Okay, he never mentioned that Graha Chikitsa is only for the adults or only for the children. No, it is for general. There actually in Graha Chikitsa, as among the one branch of among the 8 branches of Ayurveda, it's more pertaining to the psychological treatment or psychological aspects, psychosis, personality disorders, behavioral disorders, mood disorders, anxiety disorders, etc. So, Graha Chikitsa talks about more subjective matter rather than objective matter. Okay, subjective feeling or subjective symptoms are more prevalent in the Graha Chikitsa. Whereas the Graha Rogas which are mentioned in Kaumarbhritya, like the Skanda, Skambhapasmara, Putana, Shita Putana, etc. Here subjective findings are less but more objective findings are seen. Patient is having vomiting, patient is having diarrhea. Okay, patient is having skin problem, patient is having respiratory problem, patient is having neurological problem. All the subjective findings, objective findings are seen. Whereas when you talk about Graha Chikitsa, more subjective findings are seen. Patient feels that he is having some problem. Patient feels that he is having some abnormal hearing like hallucination, etc. So these subjective findings are more in case of Graha Chikitsas. The subjective findings are very, very less, only few in case of Grahas mentioned in case of Kaumarbhritya. This is one of the basic difference. By taking this, we can say that the Graha Chikitsa can be better called as Graha Bada, whereas Grahas mentioned in Kaumarbhritya can be better called as Graha Rogas. Graha Bada means, what I mean to say is, see, if you look into the Grahas which are mentioned in Apasmara and Unmada by Charaka, where patient is actually normal. A normal patient suddenly show some personality changes. A patient who is normal few hours back, he now suddenly start behaving like Deva. Therefore it is called as Deva Graha. Suddenly he start behaving like Rakshasa. Therefore it is called as Rakshasa Graha. What I mean to say is, we can observe some sudden behavioral and sudden personality changes. Okay, or sudden changes in the psychology of the patient, mood changes, whatever. It may be schizophrenia, mania, whatever. Sudden changes will be seen. So this is dealt under the concept of Graha Chikitsa as one of the branch of Ayurveda. But such type of findings are not in Graha Rogas, which is explained in Kaumarbhritya. In the Graha Rogas are explained in the Kaumarbhritya. So for example, if you take Shita, it has Shita Putana. It has got some causative factor, and there is some dosha vishesha. There is some dosha vitiation, and there is involvement of some of the symptoms, and there is some treatment. Yukti Vapashraya and Dayu Vapashraya both. See, in case of Graha Bada, we know that mainly the treatment is focused on Dayu Vapashraya, not Yukti Vapashraya. Whereas in Graha Rogas, which is mentioned in Kaumarbhritya, Dayu Vapashraya and more of Yukti Vapashraya treatment is mentioned. So this is more subjective. Structural changes are seen, actual pathological changes are seen. Whereas in Graha Bada, usually the functional changes are seen, behavioral, personality, etc. So this is one of the important aspects which differentiate between Graha Chikitsa and as well as Graha Rogas. Now, in case of Graha Bada, or what I say, Graha Chikitsa, as one of the separate branch of Ayurveda among the 8 branches, the morphology of the Graha is not mentioned. Morphology then means, suppose I say Rakshasa Graha. Rakshasa Graha is not understood by the morphology as Rakshasa. Rakshasa Graha is understood by the behavior just like Rakshasa. The patient is become suddenly very cruel, violent, just like Rakshasa. Therefore it is called as Rakshasa Graha. Patient is suddenly interested in dancing and singing, etc. and luxurious life, etc. Therefore it is called as Gandharva Graha. That means there is no particular structural identification for that particular Graha. Only functional identification will be seen. Whereas Graha Rogas which are mentioned in Kashyap Samhita or in Kaumarbhritya, there are some structural or morphological changes are mentioned how this Graha looks like. If I say Mukhamandika, he explains how this Mukhamandika looks like. A Skanda Graha, what is the morphological features of Skanda Graha, how it looks like. So this particular structure and morphology of particular Graha is mentioned, which is not at all seen in case of a Graha Chikitsa. Okay. Now, no periodicity is mentioned. Now, if we look at other Grahas, Pakshadva, Dwadashadva, Masadva, the symptoms will go into repeat in episodic manner, isn't it? Whereas grahas which are mentioned in case of Kaumarbhritya, there is no episodic nature of the Graha Rogas. Once it started, it is continuous and fastly progressive. That is one of the basic issue, how it is different from the Graha chikitsa. Of course, in the Kaumarbhritya grahas, there is a definite dosha vitiation is seen and definite pathological changes will be seen. And this definite dosha vitiation and pathological changes are actually absent in case of grahas of Graha chikitsa. Because we know that it is simply a psychological deprivation or psychological perversion, or we say psychological changes, personality or behavioral changes. We cannot expect any pathological changes are there. Only functional derangements can be seen. Okay. And one more important thing is in case of Graha chikitsa, see, fever is not a important symptom there. If you look into, patient may feel hot body, that is a different issue in case of Rakshasa Graha, Bhuta Graha, etc. Otherwise, there is no fever. Whereas when we talk about the grahas of the Kaumarbhritya, fever is the first symptom. It is a Pururupa. Pururupam Bhavetesham Jwaram Satatam Rodanam. Jwara and Satata Rodana are the Pururupas. So fever is there. When I say fever is there, these grahas which are mentioned here, they have got some infective nature. Otherwise, there may not be fever, because we know that 99% of the cases of fevers are associated with the infection. Of course, fever may be there without infection also in some of the cases, but 99% is with the infection. So fever is mentioned there. So we can attribute the Graha Rogas mentioned in Kaumarbhritya to the infective origin, whereas Graha chikitsa, which is mentioned in the other branches, it is not infective origin. So there is personality changes, behavioral changes, mood changes, okay, loss of time sense, orientation, higher mental functions are get affected. And grahas which are mentioned in case of Graha chikitsa, so there very rapid transition will be there. Suddenly the patient start behaving abnormally and sudden relieving will be there. Within few minutes or within few hours he will be okay. But it's grahas which are mentioned in Kaumarbhritya, they are not like that. They very slowly start, rapidly become progressive, and the severity will be more. And if you don't diagnose it in right time and also not give the proper management, the child may going to die immediately. That means pathological changes do occur there, and they are very, very fast. Whereas in case of Graha Rogas, they comes in an episodic manner, and they will be there for a particular time. Then there is a inter-episodic period which is totally free of symptoms. So these are some of the enough points which explains very clearly that the Graha chikitsa and Graha Rogas, they are completely different. Okay, therefore the Graha Rogas of Kaumarbhritya, they are having some infective focus. There is some infective focus is there. Whereas in Graha chikitsa, whatever the grahas are mentioned, they do have some personality and behavioral problem related issues. So this is what I want to say. That's the basic difference between Graha Roga and as well as Graha Bada. Okay, so in Graha chikitsa, the problem which is occurring, the psychological or functional changes which are occurring, can be considered as Graha Bada. Whereas the grahas of Kaumarbhritya, where there the infective focus is there because of the fever, it can be better called as Graha Roga. Can be called as Graha Rogas. Now this part already we have discussed what is actually the Graha Bada. In certain grahas there may be personality changes and as well as behavioral changes, and there will be sudden personality changes which is happening in the normal person. He suddenly start behaving like Deva, Gandharva, Asura, etc. We have seen all these and discussed already. Such explanations are also available in Ashtanga Sangraha Uttara Tantra. But the fever is totally absent there. And that fever is present in case of Graha Roga Pururupa. So that makes the big difference. So Graha chikitsa is more likely to be a psychological aspect, and Daiva Vapasha chikitsa is the main treatment. Graha Roga is something related to the body structures, and there will be structural involvement, pathological changes will be there. which are evident, and as well as this requires basically the Yukti Vaparsha Chikitsa along with the Daiva Vaparsha Chikitsa. So this is about the first part of Graha Rogas, and next we will continue the same in the next class.